So the research article that I chose to do was on ankle sprains, the benefits of taping versus bracing, and within that, the cost benefit and the numbers to treat. So the brief description was basically to reduce or decrease the amount of ankle sprains. 70% of the ankle sprains that healthcare professionals see are recurrent, meaning an athlete will sustain an ankle sprain. Over time, they will end up re-injuring it at some point. However, when trying to eliminate those risk factors, that has not been determined yet. The hypothesis or research question was about examining the effectiveness of ankle taping and bracing and reducing ankle sprains by applying NNT, which is numbers needed to treat, and reducing or preventing further ankle sprains. So the overview was basically about history of ankle sprains versus history without ankle sprains. In athletes, specifically in basketball, football, and volleyball, the ratio varies quite a bit. So the study determined in order to prevent one ankle sprain per game, a clinician would have to tape 26 ankles with those who have sustained past ankle sprains or have a current one. In comparison, an athletic trainer clinician would need to tape over 100, or specifically 143, in those who have not sustained an ankle injury or a past ankle sprain. Some of the better practices with taping or bracing is mechanical support, neurological effects, and psychological benefits. Mechanical support with bracing or taping, it keeps it compact, keeps it stable, and does not allow it to move with full range of motion. And with the psychological benefit, with those athletes, they feel more supported whenever they are playing or performing their respected sport. Overall, the study predicted that or found that bracing was a better way than taping. Mostly because when considering time, cost, and overall injuries, bracing was the most effective way. Some of the strengths that I found in this research was that there was an extensive support on bracing versus taping. The main reason was the cost of benefit and numbers needed to treat. So some of the stats were bracing over taping over the course of a season was actually 3 times as more economical than taping. So the cost to brace rather than tape was exponential. It was so much lower to brace than tape. Some of the limiting factors, however, were that there was very limited NNTs and not as many effectiveness studies that were completely surveyed. Overall, the study was on ankle sprains, how to prevent further ankle sprains, whether that be through taping or bracing, the numbers needed to treat, and the cost benefit. Thank you.